Good afternoon, everybody. My name is Isabella Sudano and I'm junior consultant in the cardiology unit of the University Hospital in Zurich. And today I will try to give you some information about the sympathetic nervous system. Pain, fear, stress, anger, but also strong positive emotion have all something in common. They all activate our sympathetic nervous system. Sympathetic nervous system is a part of the autonomic nervous system, together with the parasympathetic nervous system and the enteric nervous system. Sympathetic and parasympathetic division typically function in opposition to each other. Opposition doesn't mean antagonism, but the better term is complementary. Sympathetic nervous system is responsible for quick response, while parasympathetic nervous system for action that doesn't require immediate action. For that reason, if we can summarize, we can say sympathetic means fight and flight, and parasympathetic means rest and digest. Let's see the effect on the cardiovascular system of these two parts of the autonomic nervous system. As first, the lung. We have a dilatation, bronchodilation by sympathetic nervous system activation and a bronchoconstriction by parasympathetic nervous activity. Then heart. Sympathetic may increase heart rate, while parasympathetic part decrease heart rate. And the blood vessels are constricted by activation of sympathetic nervous system and dilated by parasympathetic nervous system. That means that the sympathetic response means increase in blood pressure, and the parasympathetic response is a reduction in blood pressure. There are multiple physiological and pathological conditions that may have an effect on sympathetic nervous system. Aging, for example. We are getting older and our sympathetic nervous activity increase. Menstrual cycle as well as hormonal therapy, they have an effect on autonomic nervous system. Smoking has major effect on sympathetic nervous activity. It activates sympathetic nervous system, as well as coffee drinking. Physical exercise may reduce sympathetic nervous system activity. Shift working and sleep deprivation have also a high impact on the activity of the sympathetic nervous system. Looking at pathological condition, heart failure is a condition characterized by high increase in sympathetic nervous activity as well as hypertension, obesity, sleep disorder, as well as sleep apnea syndrome, preeclampsia, renal disease, thyroid disease, panic attack, and of course the primary alteration of the autonomic nervous system. Let's summarize the effect of sympathetic nervous system on cardiovascular. The activation of sympathetic nervous system is leading to endothelial dysfunction. So it means that the internal part of our vessel is not working properly. That leads to atherogenesis. Sympathetic nervous system regulates also our glucose by increasing insulin resistance. The platelet, the small cell that are responsible to care about our wound, are hyperactivated. Sympathetic nervous activity may lead to cardiac hypertrophy, to arrhythmias, and to vascular hypertrophy. So, an increased activity of sympathetic nervous system lead to increased atherothrombotic problems. Let's say the physiological effect of a stimulation of sympathetic nervous system and its clinical consequence. As told, we have an increase in heart rate and blood pressure. That leads to vasoconstriction, and this vasoconstriction is increased if endothelial dysfunction is present. All these conditions lead to myocardial ischemia. That means myocardial infarction and, at last stadium, heart failure. We have a pro-arrhythmogenic effect leading to arrhythmias. The existing endothelial dysfunction may be worse and proceed to endothelial injury, both responsible for the vulnerability of the plaque. And last but not least, we have platelet activation leading to thrombosis. We have several methods to measure sympathetic nervous activity in humans. We can look at cardiac sympathetic nervous activity with the noradrenaline spillover. We have imaging technique. We can measure plasma catecholamines or the forearm noradrenaline spillover, the kidney noradrenaline spillover, and then we can measure sympathetic nervous activity directly in the nerve of the skin and of the muscle. The muscle sympathetic nervous activity is much more important because it reflects the part of the sympathetic nervous system regulating heart rate and blood pressure. That's how we measure this. An electrode is placed in the nerve and we measure the sympathetic nervous activity together with respiration, ECG and blood pressure. We can measure muscle sympathetic nervous activity in many conditions, starting by control to patients with hypertension, obesity and congestive heart failure. We will see an increase in muscle sympathetic nervous activity, and this increase is much more to see if congestive heart failure is combined with more risk factor. We have intervention to improve autonomic function and to reduce sympathetic nervous activity. For example, exercise. If I increase my physical activity, then my sympathetic nervous activity will decrease. Religiosity or meditation may have a positive impact on sympathetic nervous activity, as well as restoration of normal sleep, weight loss, and smoking cessation. If the lifestyle modifications are not enough, I can use medication such as beta blocker or ACE inhibitors. So in conclusion, sympathetic nervous system have a key role in cardiovascular homeostasis control. It regulates cardiac output, systemic vascular resistance, heart rate and blood pressure. Alteration of the activity of sympathetic nervous system, which characterize cardiovascular disease, are not irreversible. We can change them by pharmacological or non-pharmacological intervention. Thank you so much for your attention.